Hi, my name is Alvarez, and today I'll be showing you how to change a wet to dry sterile dressing. So first I'm going to check the physician order and make sure that the dressing has to be changed during my shift. I'm also going to note if there's any medicine that has to be given 30 minutes before the procedure for pain. And then I'm going to gather my supplies. So I have my drape for the sterile field, a couple of gauze, my ABD pad, my tray, sterile gloves, normal saline water, and tape. I also want to put a garbage bag at the end of my table so I can put away any dirty gauze or dressings. So first I'm going to wash my hands, put on my gloves. And then I'm going to introduce myself and identify my patient. Hi, my name is Christine. I'll be your nurse today. Can you state your first and last name, please? Your date of birth? Okay, thank you, Mr. Smith. So today I'm going to be changing your wet to dry sterile dressing that's on your leg. Do you have any questions? Okay, so now I will provide for privacy before I start anything. And then I'm going to expose the wound, but I want to make sure that I'm not overexposing my patient. So now when I take off the dressing, I want to observe odor, look at the border of the wound, see if there's any necrosis, see the surrounding skin, make sure it's pink, that it looks like it's healing, observe any drainage, how much. Also, I would take a ruler or do the thumb test to see how long the wound is. So then I would just throw this out, dispose of my gloves. And now I'm going to set up my sterile field. So first, taking the drape, opening it away from my sterile field, touching the blue part. And when I open it, I want to make sure it's above my waist and it's not touching any other surfaces. Now I'm going to open my tray. Open the gauze. Open my ABD pad. And my normal saline. If this was a used bottle before, I would just open it and lip it and make sure that my hand is in the label. So I'm just going to pour a little bit. And then I am going to get my tape ready. So now I am going to open my sterile gloves. I'm going to the dual set of my sterile field. Everything organic today. pinch the inside. So this will be my clean hand, this will be my dirty hand when I clean the dressing. So then I'm going to get my gauze, wet it, wring it out, drop it in my dirty, and wipe one way, and throw it out. Get a gauze, clean it, wipe around one edge, get a gauze, and wipe the last edge. So then, if it's wet still, I would get another gauze with my clean hand and dry it. But now I'm ready for my packing and for my ABD pad, so then I'm gonna take these off and don on new sterile gloves. But for purpose of validation, I'm just gonna keep these. So then I'm going to pack my wound with my new sterile gloves. Get my ABD pad, make sure I'm only touching the blue part. Open it up. And I'm going to take my tape and just secure it on there.
Okay. After I've done that, I'm going to make sure I also open my abdominal pad.
Then I'm going to take off my sterile gloves. And I can continue securing the ABD on the patient.
So then I would go ahead and take off.
I'll also write on a piece of tape my name, the date, and the time that I put the dressing on, and just place it on top so the next shift knows when it was last changed. And then I'm going to clean up my field, wash my hands, make sure that the patient's okay. Put the side rail up, place the call belt, and lower the bed to the lowest position. And then when I leave, I'm going to document the border, the odor, the drainage, the measurement, and any input-output that was performed in the procedure.